My name is Amber Booth McCoy, and I'm a senior diversity specialist in the Division for Diversity, Equity, and Inclusion. And today we are talking about myths, facts, and fiction when it comes to COVID-19. And we have with us Dr. Gloria Richard-Davis. Hello, Dr. Richard-Davis.
Hello, Amber.
Why don't you tell us a little bit about yourself?
I am a professor and faculty in the Department of OBGYN at University of Arkansas Medical Science. My training is actually in OBGYN, and subspecialty is reproductive endocrinology and infertility specialty. I have practiced in women's health for over 25 years. So lots of time delivering babies and helping families achieve pregnancy. But in addition to that, I also trained in the military. And so during my residency and payback time, spent a lot of time really preparing for wartime, which is really kind of what we're dealing with right now, right?
Very much so. Okay. Your background never ceases to amaze me. You have lived so many amazing lives. So let's just jump right in with these myths and uncover some truths here. So is COVID more common in certain races or ethnic groups?
So the short answer is no. COVID does not.
You mean COVID doesn't know I'm Black?
It doesn't know you're Black, okay? It doesn't know your race, your ethnicity, none of that, right? So we all have the same risk of being infected and transmitting infections, which is an important thing for us to remember, because when we talk about within our communities and social distancing, it becomes really critical for us to listen and follow.
So just making sure I understand, African Americans are not immune to COVID-19.
Not in the least. In fact, if you look at, the data that's coming out, really, African Americans are being infected probably at the same rate. But what we realize is there are certain preconditions that African Americans have, like hypertension, diabetes, asthma, heart disease, right? Any autoimmune disease, all of those conditions increases the likelihood that you will become really sick when you get infected with COVID-19. So because of that, what we're seeing is an increase in the severity of the African Americans who are getting infected and an increase in mortality. So all the more reason why we need to be vigilant in preventing infections.
I remember once I was doing a panel and the moderator said this saying, and said that when white America gets a cold, Black America gets the flu. And I guess that's kind of what we're looking at, right? It's not that we're getting infected at higher rates, it's that we have underlying issues that are affecting us more.
Absolutely, and that's a great analogy.
Okay. So is COVID only found in hot and humid climates? Should I just go to Hawaii till this is all over?
If that were true, I'd be on the beach right now. No. We talked about things like, well, you look at Africa and there doesn't seem to be the same rate. But the reality is we have to think about multiple reasons why that may be true. It's not just about environment. It's about resources. It's about the ability to test people. Mm-hmm. And so there were several countries globally when they looked at the map and said, these countries seem to have lower infection rates. Well, probably not. They're just not getting tested. Okay. So the environment has nothing to do with...
It's not the heat.
No, it's not the heat. And no, when the summer comes, doesn't mean that we won't have a problem.
Okay. So what about this one now? What about if I make sure that I take my alcohol, my bleach, and my chlorine, and I just spray it all over myself before I go out? Am I protected? Does it kill the disease if I just spray it all on me?
It will not kill the disease. And you may, in fact, cause some injury to things like your eyes, right?
Or even my
So
clothes if I pour bleach on.
in your clothes, that's exactly right. All this clothes that you spent money on, I don't think you want to damage it. But the thing that you have to remember is the virus enters our body through the mucus areas, right? So one of the things that we talk about is washing your hands, right? Being digital about washing your hands. Don't touch your face, because when you touch your face, you're potentially touching your eye, your nose, your mouth, right? And so anything that's on your hand, and we carry a lot of things under our fingernails,
Mm-hmm.
right?
Mm-hmm.
You potentially infect yourself. So that's another reason why we say don't touch your face.
Okay.
Those are the zones that you are susceptible in. Your
Gotcha.
skin doesn't typically allow infections. That's our barrier.
And washing our hands is that much of a protection. It makes that big a difference to continue washing our hands.
It makes a huge difference because your fingers is where you touch everything. I mean, you don't even think about it. You're
Right.
touching surfaces all the time. And when we talk about the virus, really the mucous membranes is the entry point,
Mm-hmm.
right? But we also realize that the virus lives on hard surfaces, right?
Mm-hmm.
So it can live hours, sometimes 17 hours on surfaces that you come along, somebody's been there, they've touched it, or some of their saliva is on it, right?
Mm-hmm.
And you come behind them and touch that surface.
Mm-hmm.
Think about the doorknobs, the handles, all those things that we touch, elevator knobs.
Okay. So what about mask? I just got this one, just got a new mask. It has filters in it. So first they told us we shouldn't wear masks, and now we're hearing that we should wear masks. What should we actually do?
Well, it's been a transition because obviously we're learning as we go with this virus. They don't call it novel for nothing. It is new, right? We've never had this type of infection before. And so the CDC, the Center for Disease Control, who is really our guide in a lot of this, that they're the experts. And so it is their guidance that we're following. So recently they made a change. They said initially we didn't really need to wear a mask unless you're infected. And so anybody who is potentially infected, the first thing we say to them, if you're coughing, put a mask on, right? Because when you're coughing or sneezing, you are forcing droplets out into the air. And that's how you're infecting other people, even by talking, right? So if you're wearing a mask and you're potentially infected, then you're less likely to infect other people. So for us, it is a way of us controlling what's getting here, right? We keep talking about these areas. So it's not getting to your mouth. Now, viral particles, if you're wearing just a regular mask, it doesn't mean that viral particles can't penetrate it, but it's less likely that you'll be projecting, right, past that. And if you keep your social distance, then you're less likely to be infected. So the mask doesn't mean that you still go up to somebody. You still need to keep those distances. It's just another layer.
And the mask is more so me being a good citizen, friend, family member, and protecting others from me because I could potentially have it versus it being this barrier that I'm putting on a shield to protect myself. Is that correct?
That's exactly right.
Okay.
That is correct.
So we have people die from the flu every year. We talk about how many people that are, the mortality rate of the flu. So is COVID not the same as the flu? Because I get my flu shot and I stay pretty well. Is that why I maybe think I don't have COVID or, how's it different?
I'm happy to hear that you get your flu shot. And so should everyone else. We typically tend to have an issue with vaccines, but it's really important because the flu virus basically mutates every year. So we don't know which virus we're going to have. The symptoms, there are a certain amount of overlapping, right? In terms of the coughing, right? The fever. Those symptoms with flu and COVID-19 are a coronavirus. They're in the same family, but they're not the same virus, right?
Hmm.
So,
So I was gonna say, so I keep seeing like the Lysol spray, and it says Corona, and everybody's saying this isn't, that we've had this for a long time, and so you are saying coronavirus is not new. This one is
this
new.
was new. It is novel COVID-19. I keep emphasizing that. It's really much more similar to things like SARS. If you remember,
Mm-hmm.
in 2005 or so, we had some very severe episodes of SARS virus, and then MERS, which was in the Middle East. Those are acute respiratory diseases, right? This virus is more similar to those than it is to just the flu, but they're all in the same corona family.
Okay. And if we're going to be about maybe some specific myths, I recently heard lemon juice, maybe lemon juice in the nostril, which sounds more like it would burn, but is that going to at all protect me? Is the acid in lemon juice going to help me from getting COVID?
Nothing about lemon juice or any acid or any Lysol or alcohol. Alcohol is great on your hands, okay? That's what's in our hand sanitizer. So, yes, use it appropriately. Don't think that you can put it all over your body and it's going to protect you, because it's not. You think about lemon juice is citric acid, right? Um, Acidic fluids is what we have in our stomach as well, right? So you have people talking about drinking warm fluid. There's all sorts of myths out there about how you protect yourself. But the best protection
Mm-hmm.
is the defense that we keep talking about. Social distancing, sheltering in. If you don't have to be out, stay home. Stay home. Go
So,
out for essential things. You need food, you need medicine. Yes, go out for those things.
okay.
Not to go out and socialize with your neighbors.
It's not for parades and such?
It is not for parades.
Okay.
Absolutely not. Because that's a disaster waiting to happen.
So what we need
And
to
then you
do is,
think about,
like our mom said when we were younger, we need to get somewhere and just sit down. Just sit
absolutely,
down. Okay.
absolutely. And and that's hard for us to do as
Mm-hmm.
a society,
Mm-hmm.
because we're so used to being mobile and being social, right? We talk about the communities of faith
Mm-hmm.
and the fact that when we think about, sort of our core, right, our spirituality, we think about convening with people in the church, right?
Mm-hmm.
That's where you go for your solace.
Especially
And
during times that are scary like this.
absolutely, absolutely. But you can't do that now. So go to church online,
Mm-hmm.
Facebook Live,
Use
right?
that main line that they told us he had, because
Yes,
he was on the main line when we were
yes,
growing up, right? So just use
absolutely,
right
absolutely. You know, exactly. Call them up, and
and tell
talk
them
to
what
them.
you want, right?
That's exactly right. But don't go to churches, don't go to funerals, because that is really asking for a disaster.
Okay. Well, Dr. Richard-Davis, I thank you so much for sharing all of this knowledge with us today. Before we get out of here, is there anything else that we need to know, anything we should keep in mind as we get ready to prepare for this pandemic and continue to stay safe?
I think the key thing really is, um, be vigilant. Listen to what our experts are telling us. Because if we don't, this will go on for a longer period of time. We keep talking about bending the curve. These peaks in incidence, right, and mortality or death. If we don't bend this curve, if we don't bring that down, then we will potentially overwhelm our health system, where we cannot take care of the number of people who will get sick. And therefore, your death rates will go up.